9 de marzo de 2023. Soy Luciana Viegas, asesora de Asuntos Públicos en la OPS, y muy bienvenidos a la primera conferencia de prensa del nuevo director de la OPS, el doctor Jarbas Barbosa. Como siempre, voy a hacer la moderación en español, pero contamos con interpretación en inglés, francés y portugués, y podrán hacer las preguntas a través del botón Q&A. Tienen, claro, la opción de hacer las preguntas en vivo. Por favor, nos avisen. También los que nos enviaron preguntas con antelación pueden ponerlas en vivo aquí hoy en la conferencia. Recuérdense, por favor, también de identificarse con su nombre y el medio que presentan para hacer las preguntas. Vamos a empezar con algunas palabras del director sobre la situación de COVID-19 en la región tras 3 años de la pandemia. Y pasamos después a las preguntas. Acompañan al doctor Barbosa hoy el doctor Marcos Espinal, subdirector interino de la OPS, el doctor Ciro Ugarte, director de emergencias en salud de la OPS, y el doctor Silvan Aldiguiere, gerente de incidente para COVID-19 en la región, en la OPS. Paso ahora la palabra al doctor Barbosa y pasamos a las preguntas.
Muchas gracias, Luciana. Buenos días. Gracias por unirse a mi primera conferencia de prensa como director de la Organización Panamericana de la Salud. Ustedes, los periodistas, son socios fundamentales para apoyar el logro de nuestros objetivos en salud. Me alegra ver a tantos de ustedes conectados. No tengo duda de que la comunicación directa, transparente y confiable es la mejor manera que tenemos para mantener todas las personas bien informadas y que puedan, con esas informaciones, tomar siempre las mejores decisiones para proteger su salud, de su familia y de sus comunidades. Quisiera también agradecerles su apoyo durante los últimos años y decirles que mi intención es continuar con ese diálogo abierto, transparente con ustedes en el futuro. Al asumir el cargo de director de la OPS, uno de mis objetivos principales es ayudar a los países de las Américas a superar la pandemia de COVID-19. Hace poco más de 3 años, el 26 de febrero del 2020, se confirmó el primer caso de COVID-19 en América Latina, en Brasil. Desde entonces, la región de las Américas tuvo más de 190 millones de casos, que corresponde a un 25% del total mundial de casos, y más de 2,9 millones de muertes, casi el 43% del total mundial. Nuestra región, desafortunadamente, y por diversas razones, fue una de las regiones más afectadas por la pandemia, y tuvimos en muchos países de la región no solo el impacto negativo produzido sobre la salud, pero el importante impacto produzido sobre las economías, sobre las personas, el incremento de la pobreza, o sea, fue un período muy difícil para nuestra región. La pandemia também ha subrayado que nenhum país ou organização do mundo estava totalmente preparado para o impacto de esse novo vírus. Esse, sem dúvida, é o caso das Américas também, que é uma região marcada por tantas inequidades. Se bem não estamos fora de perigo, nos encontramos em uma situação muito melhor. Hoje, a incidência de COVID-19 é entre 20 e 30 vezes inferior à la de hace um ano. A OPS desempenhou um papel clave para ajudar os países a mitigar os impactos da pandemia, proporcionando orientação técnica, vacunas, pruebas diagnósticas, oxígeno, tratamentos e outros recursos que salvam vidas. E foram muito importantes para nossos países durante as fases mais agudas da pandemia. Entre alguns exemplos dessa cooperação técnica que ha brindado a OPS, puedo mencionar que criamos a Rede Regional de Vigilância Genômica de COVID-19, aumentando a capacidade em ao menos 6 países para hacer sequenciação genética por primeira vez. Isso facilitou a carga de mais de 580.000 sequências de América Latina e o Caribe em las bases de dados mundiais. Esta rede é um ativo que permite a los países monitorear o vírus que causa a COVID-19, o SARS-CoV-2, pero também outros patógenos com potencial pandêmico, incluída a influenza aviar. Esse é legado importante da pandemia que fortalece a capacidade da região de detectar uma nova variante de maneira rápida e também de monitorear as outras ameaças que temos em setor saúde. Também mobilizamos mais de 160 milhões de doses de vacinas através do mecanismo COVAX e ajudamos a los países de América Latina e do Caribe a administrar mais de 1.300 milhões de doses em menos de 2 anos. Não se trata de uma hazaña menor. Las Américas é agora a região com o segundo nível mais alto de cobertura de vacinação no mundo, com o 71% de cobertura de vacinação contra a COVID-19. Pero a COVID-19 sigue entre nós outros, e o vírus aún tem que assentar-se em padrão predecible. Só no último mês, hemos visto mais de 1,5 milhões de novos casos em nossa região e 17.000 muertes. Deixe-me agora cambiar para inglês. I will now switch to English. So, with this situation, we cannot be complacent. As we learn to live with this virus, countries must first maintain and continue to strengthen surveillance. We know that COVID-19 can evolve and adapt quickly. The risk of new variants is real. Testing rates have dropped, but we must maintain monitoring and report this information to PAHO and global mechanisms. Second, we need to continue implementing COVID-19 vaccination programs, reaching out to the 30% who have yet to receive their primary series. So we have, unfortunately, many millions of people that haven't had access to the first doses of COVID-19 vaccine yet in our region. That is a challenge for our countries, and PAHO is supporting the countries to address this very important topic. It's also important that uptake for boosters also continues to decline, but they are essential in preparing ourselves for any new wave of infection or new variant of concern. Vaccines are now readily available, so we must be determined and vigilant to reach each and every person. It's very important in this regard that the countries need to develop and implement new strategies to provide the more clear and transparent information to the families and communities. It's important also to engage the health professionals, because we need to use the vaccines that are now available to protect more people in our region, to save more lives, to avoid these deaths that are still happening, mostly focused on people that are not vaccinated, or that people that who don't have the boosters yet. And in general, there are people that have some health conditions, non-communicable diseases, elderly people. So it's very important to continue this effort to have everybody vaccinated in our region. It's also important to continue to advocate for more equitable access to medicines and vaccines using science and innovation. Latin America and the Caribbean still import 10 times more pharmaceutical products than it exports. Strengthening regional capacity to produce mRNA vaccines, for example, can help our countries to better manage COVID-19 and other emergencies in the long run. We have the tools to end the COVID-19 emergency, but we need to continue working if we want really to have the complete control and to stop the transmission in the near future. We need to strengthen surveillance and to get more data, and we need to increase vaccination coverage with equity always at the center of our efforts. Our region experienced setbacks over the past 3 years that have revealed and/or exacerbated weakness in our health system, in the detection and treatment of diseases such as TB and HIV, in testing and treatment for non-communicable diseases, and in declining rates for routine vaccination against polio, measles, and other preventable diseases. 3 years on, the pandemic presents us with a unique opportunity to place health firmly where it belongs, front and center of the Sustainable Development Agenda. We must focus on recovering losses and on rebuilding resilient health systems that work for everyone, as well as being better prepared for future health threats. This will require increased public spending to expand the access to quality health services, especially the most vulnerable population, investments in primary health care, and building capacities to ensure a sufficient and appropriately trained health workforce. Our countries will also have a very important opportunity participate in the global debate about how to develop some changes, to implement some changes in the international health regulation, and also to establish a new instrument that will allow the world to be better prepared for a new pandemic. The discussions are going on, and we are facilitating the participation of all member states of the Americas in this crucial debate that will be finalized by next year with the approval of the new instrument and the new changes in the international health regulation in the World Health Assembly 2024. PAHO stands ready to support our countries in the Americas to learn from and apply the lessons we have learned from the COVID-19 pandemic. Thank you.
Gracias, Dr. Barbosa. Perdón, los periodistas nos avisen si quieren hacer las
Thank you,
preguntas.
Dr. Barbosa. If you'd like to ask questions live, please do so in the chat, and then we will give you the floor. We have a question from Matias Levy in Medscape. I know he's connected, but he didn't answer me. So I will read his question that we received. Marias asked, is it proper to say that at this stage of the pandemic, the impact of the post-COVID-19 syndrome and the millions of persons affected by this could end up becoming a major concern, a bigger concern for public health and for acute infections? My other question is, how effective are the vaccines at preventing complications or secondary effects over the long term? I give the floor now to Dr. Espinal. Thank you for that question, Matias, Luciana.
El síndrome del COVID a largo plazo.
Long haul COVID, COVID-19 has different names applied to it, but basically these are symptoms that occur after a month or even after 3 months and persist. Symptoms such as just fatigue, but could end up being pulmonary neurological problems. And research in this area is still very generic. But what we have observed is that fatigue is a key factor, and also mental health problems. I wouldn't venture to say yet that this is going to be a bigger health problem than the pandemic itself, because the pandemic hasn't ended yet. We are still reporting thousands of cases globally. So what's important is first end the pandemic. The research will continue, but the key to preventing the long haul COVID is to continue vaccinating people, not just with 1 dose, but with the various recommended doses and what we call as boosters as well, because that is what will prevent the post-COVID syndrome or long haul COVID. And most studies, the majority of studies suggest that 10 to 20% of the patients who have COVID could end up developing the post-COVID, the long haul COVID syndrome. But it has also been confirmed that if we do not vaccinate ourselves, the risk is much greater to end up with the post-COVID syndrome. So the message is continue vaccinating, but we don't think the answer yet is to conclude that one is going to be a bigger problem than the other. The main health problem continues to be the pandemic. And if we vaccinate ourselves, we can avoid to a great extent, to high probability, the risk of having the post-COVID syndrome.
Gracias, doctor. Espinal, seguimos con algunas preguntas
Thank
más
you,
específicas
Dr. Espinal.
de
We have
de la Agencia de Noticias
another question about long COVID from Jaime Arnaz, the agency in Spain, wants to know how many people with long COVID do you think there are in Latin America or the world? And are there any developments in research, diagnosis, and treatment? Also, what studies are being carried out, and what are the preliminary findings? Thank you for the question. They were very clear. Regarding prevalence, studies show that between 10 to 20% of people with SARS-CoV virus may develop symptoms that could be diagnosed as extended or long COVID. If we go with the conservative number, which is 10%, that would mean there are millions around the world who have had this status after an acute infection or are still having those symptoms. As for treatment, some treatments have been effective for a set of symptoms. WHO has a definition of clinical cases in adults and children based on a global consensus. But in order to have updated evidence on treatment, the Pan American Health Organization has developed an updated site which is live and presents new information as it becomes available. And we're also working with countries in order to have a clinical surveillance platform for long COVID patients. That site will have information about the patient's symptoms and how they've been treated. We're reusing and testing medications to treat long COVID. So this is how evidence is generated to assess both the safety and effectiveness of these treatments. The review, published in March 2023, just recently, includes 33 clinical trials. In the case of diagnosis, the diagnostic tools are still being developed, but many providers are implementing diagnostic recommendations and also specific tests based on clinical symptoms. For example, they're looking at orthostatic hypertension, they're detecting microclots, looking at arrhythmias, among others. So it's a fairly broad set, and it's also complex. Finally, as to research, many countries and institutions are working to better understand the pathogen and also the diagnosis and treatment. More studies, large-scale studies are needed, as well as a comprehensive research agenda. I hope this answers the set of questions from the colleague from Serve Media. Thank you, Dr. Alighieri. Now go to a question from the Caribbean.
Again, you need to let me know if you're able to do or willing to do the question live. So I'll just read it for the time being. Stephen's question is, seemingly the checks and balances put in place for the monitoring of COVID in the Caribbean region are dwindling. How does PAHO keep tabs on countries to ensure that the information provided regarding the disease is accurate? Dr. Ugarte, please.
Thank you, Luciana. Thank you, Stephen, for this question that applies to many countries. As was said, most of the countries in the Americas and the world are seeing fewer cases of COVID-19, and enhanced surveillance is being progressively shifted to integrating COVID-19 into regular respiratory virus disease and outbreak surveillance. That is the way to proceed. And as Dr. Jarvas indicated, the region and the world still needs to need to maintain a timely and appropriate information of the COVID-19 trends and the virus involved, so we can early initiate the appropriate control measures and also prevent a new surge of cases and the dissemination of a new variant. PAHO is closely coordinating with our member states on strengthening the regional genomic surveillance capacity. So we closely coordinate with each of the member states and regularly interact also with the national authorities to update and review the information and the trends. And the COVID-19 figures regarding the Dutch territories, including St. Martin, are low. And the system for testing is set by the RIVM and the National Institute for Public Health and the Environment. And it is an area where the territories are also improving the surveillance. So it's a matter of coordination, close coordination with the member states. And we are, as I said, closely monitoring that information. So we are asking all the member states to continue the surveillance at the same time that the number of cases are clearly reducing in most of them. Thank you.
Thank you, Dr. Ugarte. Pasamos a una pregunta de Guatemala, Daniel Cuyin, de TN23.
Thank you. A question from Guatemala, Daniel Cuyin. How do you assess Guatemala's situation over the past 3 years, and what would you recommend to our population as we are getting close to Holy Week and Easter celebrations? We look forward to your answers. Thank you. Thank you, Luciana and Daniel, for that question. Guatemala still has vaccination coverage for COVID-19, which is at 40% of the population, and the country does have a vaccine stock. So what we are recommending is that everyone complete their vaccination schedules as soon as possible. As we're getting close to Easter week, there will be more opportunities for the virus to spread from person to person. There's one major concern, and it's for those who are most vulnerable. So against that backdrop, we also are recommending that general protection measures be applied. The measures that we have been advocating, like using masks, and an important reminder for Guatemala, which also applies to other countries, is that it is important for anyone having respiratory symptoms to stay at home and receive care. And if they need to go to public spaces, they should follow the recommended measures. In Guatemala, in April of this year, there will be the vaccination week for the Americas. So we will use that opportunity to try to enhance vaccination levels throughout this region. We've seen that vaccination levels have gone down for other diseases because priority was given to COVID vaccination, but that means that the risk of other vaccine preventable diseases has increased. Thank you. Another question from the Caribbean.
Is asking how many people died in the Organization of Eastern Caribbean States countries, which OECS's members experience the most and least challenges in the battle against COVID.
No, so thank you for this question from the Eastern Caribbean. We have to recognize that the COVID-19 pandemic has strongly impacted all the countries of the Caribbean. I'd like to highlight first the solidarity between the countries of the Caribbean, including the catalyst role of the different PAHO offices, country offices, and the close collaborations with key Caribbean partners as the Caribbean Public Health Agency and the University of the West Indies. Regarding the countries of the Organization of Eastern Caribbean States, I will focus my comment on St. Kitts and Nevis, Antigua and Barbuda the Commonwealth of Dominica, St. Lucia, St. Vincent of the Grenadines, and Grenada, which have been very heavily impacted by the pandemic. From early 2020 to EP week number 9 of 2023, which means 1 week ago, these 6 countries have reported a total of 93,700 cases and more than 1,000 deaths. All information country by country is available on the PAHO dashboard, the PAHO website. I would say that the challenges have been very similar in these 6 countries. And I'd like to highlight the complexity of surge for human resources for clinical management, and also the complexity for referral of biological samples. However, very early during the pandemic, most countries of the Eastern Caribbean have developed their own and implemented their own PCR laboratories. And in a second step, they have widely expanded the use of antigen rapid tests. I'd like also to highlight the role of the University of the West Indies that is supporting the countries in terms of genomic surveillance. And I would, even if it's not part of the question specifically, I would say that one of the main challenges in the Caribbean has been the vaccination coverage. That has been clearly lower compared to other subregions of the continent, including Central and South America, and in a context when the vaccine was and is still available. So I hope that I have answered the concerns from our colleague from now Grenada, and I have taken the liberty to expand a little bit the answer. Thank you.
Thank you, Dr. Aldigueri. We stay with this question from the Caribbean. Linda also asks, what is the estimated cost to the healthcare system for the countries of the Caribbean, the cost of vaccines, PPEs for healthcare, and what laws should be amended as COVID has now become one of the healthcare challenges that we're living with? For example, quarantine laws should be amended or upgraded, or should immigration laws be amended or upgraded when it comes to such a medical problem? I'll pass this question to the director for some comment.
Thank you. Thank you, Linda, for this question. Linda, we will get all the information about the Eastern Caribbean countries and send to you in details. But let me tell you that the costs are not related only with PPEs and vaccines, because we have had many hospitalizations, people that have requested to be in intensive care units. We also have all the costs related to people that couldn't work during the pandemic. So I think that the impact in the impact of the pandemic was estimated by some economic and financial institutions as very important. In some countries, they had a decrease of 89% of their GDP. So this is unfortunately much broader than only PPEs and vaccines, but this is specific information that you are provided by PAHO, we can send to you. About this question about the laws, of course, that every country is different, because every country has a very different legal framework to support the detection and response to public health emergencies. But the first recommendation that we are making to the countries is that they need to review very carefully what happened during the pandemic, what worked well, what didn't work well, what they needed to change, what they need to improve. You asked about immigration and quarantine. Of course, these are aspects that need to be considered, but I do believe that the most important part is how they can strengthen their surveillance system, how they can be more able to have a rapid detection and response system in place, how they can improve the laboratory capacity, including genomic capacity, of course, not in each one of the countries of the Eastern Caribbean, but as part of the network that PAHO is supporting the country, and how they can scale up their capacity when they are facing a public health emergency that will overcome the regular capacity that they have. So these were some topics that we have been observing in the countries, and I believe that this is the most part of the process now, is to review carefully, to implement all the lessons that we've learned with the pandemic, so we will be better prepared when we will face a new public health emergency of international concern. That we don't know when will happen, we don't know what virus will be responsible for that, but we know that this will happen. We hope that not with the severity of COVID-19, but we need to be ready for any situation that can happen in the world. Thank you.
Thank you, Director. Pasamos a preguntas. Tenemos muchas preguntas de medios desde México.
We go to Mexico now. We have a lot of questions there. We're going to take a question on the general situation and hope that'll allow us to speak about it instead of having detailed questions. I have a question from Elena Ochea, the reporter from Monterrey, but we have similar questions from colleagues in La Reforma, La Jornada, and Monterrey. So the question is, in Mexico, the cases of COVID-19 are decreasing. When do you expect them to increase again? Or what is Mexico's situation vis-a-vis COVID-19 situation? Dr. Albieri, could you give us a picture of the situation? Yes, thank you very much. And thank you, Melina, for that question. In Mexico, in the last week, we saw a decrease in the notification of new cases compared to the preceding week. We also saw a decrease in the number of deaths compared to the preceding week. So during the last few weeks in Mexico, 19,163 new cases, which is a decrease of 4.7% compared to the preceding week. So this is an average of about 208,000 new cases per day. At the same time, we had 114 new deaths with an average of 16 deaths per day. So it's another example, as was mentioned by Dr. Barbosa and other colleagues, that we still have the virus prevailing in the environment. The National Vigilance System and the National Genomic Vigilance System are operating on a daily basis, and they have determined the strains that are circulating in order to detect any change which may occur, including any variant. Another aspect of Melina's question is that there are many respiratory viruses circulating, but that week we detected the high levels of respiratory diseases higher than the peaks that had been observed in the weeks preceding the pandemic. So it's very important aspect of including the different respiratory viruses that are circulating in Mexico in the surveillance and describing them properly. I hope I've been able to answer Melina's question. Thank you. Thank you, Dr. Melina also asked about a different virus that is circulating amongst the population. It's not influenza nor coronavirus. Do you have any other description of it? I think that I mentioned the respiratory virus, a well-known virus that has an impact in populations at both ends of life, children and elderly. So it's a well-known situation. It's been characterized RSV, and the health services are taking measures, specific measures for this RSV virus. One last question is on the Cuban vaccine, the Cuban vaccine Abdala against COVID. Is it safe? Dr. Espinal, could you please respond to that? Yes, thank you very much for that question. First, we need to praise the efforts of Cuba has made to helping to provide high quality scientific products such as vaccines. And Cuba has a well-known track record that goes back a long time. This new vaccine developed by Cuba and that has already been approved in 6 countries in the region by their own regulatory agencies of those countries. 6 countries worldwide, and one of them is Vietnam. But the Mexican regulatory agency also approved it for an emergency. Now, the process of pre-qualifying product by the WHO is one that not only takes into account efficacy data, but also the standards that need to be followed, the labeling, packaging, the safety, all the other aspects of the vaccine. That process has now started with the government of Cuba and has been facilitated by our organization. And they have submitted the file of the vaccine for pre-qualification as emergency use to WHO. They submitted this in June of last year. Then the Cuban authorities published in Lancet magazine a study where they have demonstrated that the vaccine is efficacious and that the efficacy is 92%. So WHO is now reviewing this process. There's always some setbacks because a document is missing or something like that, but there has been progress made, and there is an article published in a significant medical magazine that have shown the results of the studies done with this vaccine. And we're hoping that at some point the WHO will issue its decision on the pre-qualification process. But you must keep in mind, first of all, that the authorization for the use in an emergency situation lies in the hands of the national approval bodies. So, and as I said, 6 of them have already approved it. I hope I've responded to your question. Thank you, Dr. Espinal. I have another question on vaccines from Fabiana Esquiavon, the newspaper Veja Health in Brazil. Fabiana is asking a question in English, but we may be able to respond in Portuguese.
Director. Thank you for this question. I will switch to Portuguese because you have translation, and I think that for the sake of precision, maybe it's better to explain in Portuguese. One of
the important lessons learned in the pandemic is that it is necessary to answer to this vulnerability that we have in Latin America and the Caribbean. I mentioned how much we import, 10 times more than what we export in terms of health products and pharmaceuticals. But it is important to recognize that we have in Latin America and the Caribbean many academic institutions that carry out research with candidates developing vaccines. We have in Brazil that capacity, also in Argentina, Mexico, in Cuba, and other countries are also organizing themselves or improving their capacities for production of vaccines. So it's important to have this strategy in order to make progress in this production capacity in Latin America and the Caribbean, with the objective of reducing this vulnerability. The PAHO also presented a public call, a public bid for 2 mRNA vaccine development, same technology used in the Pfizer and Moderna vaccines. This platform is new, and it is a platform that can be used not just for SARS-CoV-2, the present virus, but also for other coronaviruses, can also be used for other emerging viruses, for pandemic influenza and other applications. So that's very strategic. We are giving support to the 2 projects that were selected, one in Argentina, that's a private consortium called Synergy, and the other one is in Brazil, Biomanguinhos, Fiocruz. But all vaccines produced in these sites will be offered via the rotating fund, PAHO rotating fund, to all countries in the region. So the benefit has to be a regional benefit, and that's why this project is important. We're now looking for other measures, working with the countries in order to strengthen their regulating capacities, developing projects that are coordinated amongst countries that could produce the vaccine. Another one could produce components used in those vaccines. Others could participate in clinical trials. So making these initiatives to be really a demonstration of solidarity and the Pan-American spirit. Thank you very much.
Pasamos a una pregunta de las Bahamas. Tyler Simonet from Eyewitness News asks, what are PAHO's views on how the Bahamas has handled the COVID pandemic, especially as a tourism-reliant country, and whether Bahamas has reached herd immunity? He has one more question, but I'll start with Dr. Ugarte, please.
Thank you, Luciana. Well, the Bahamas has handled the situation.
Gracias, Luciana.
Pandemic in a good way. All the analysis and the joint work that has been done has resulted in the quickly adaptation of the necessary measures at all levels, both to reduce the risk for the population and also regarding how to open borders as well as the distribution of vaccines. Regarding the tourism, further analysis is needed to assess the impact on tourism and other economic sectors that will provide key information in order for the country to look at it. So in general, all the handling of the pandemic has shown that the Bahamas did well, as I said. Thank you.
Thank you, Dr. Ugarte, perdón. We have one more question from the Bahamas, from Tyler from Eyewitness News, asks, health officials have raised concerns about a stomach virus, a norovirus. Does PAHO know about this and any tips? So Dr. Adigeri, over to you.
Yes, this is totally different topic, but it has raised some concerns in the Caribbean, including in the Bahamas. And we are aware of the prevention messages that the Ministry of Health Bahamas is sharing with the population at this moment. Norovirus outbreaks are reported on a regular basis to PAHO as part of the surveillance of diarrheal diseases. And it includes a potential impact on the population and the tourism industry. So outbreaks, and it's the case at the moment, are reported in cruise ships, and they can affect a large number of passengers. Because the norovirus is a very contagious virus that causes vomiting and diarrhea. People of all ages can get infected and sick with norovirus after having a direct contact with an infected person, but also after consuming contaminated water or food, or touching contaminated surfaces. So people, what is really the trigger of these outbreaks is that people with norovirus illness can shed billions of norovirus particles, and only a few virus particles can make other people sick. So these are the classical prevention keys based on the following principles, including practice proper hand hygiene, handle and prepare food safely. When you are sick, do not prepare food or care for others, and clean and disinfect surfaces. So I think this is what we can say at this moment in the context of these prevention messages shared by the government of the Bahamas with the population. Thank you.
Thank you, Dr. Adigeri. Pasamos a una pregunta desde...
Thank you, Dr. Adigeri. Let's move on to a question from Ecuador, from El Comercio. Her question is, is there a need to encourage preventive medicine as a result of the pandemic? And what was the impact of preventive medicine before the emergency and 3 years after the emergency? Are there new strategies that states can adopt to strengthen these services? And in what areas can they adopt these? Thank you, Elena, for that question. Yes, I understand by what you mean by preventive medicine. Involves prevention of diseases, surveillance, and yes, the pandemic underscored how important this is within a healthcare system. As I said earlier, it's going to be very important that we do an analysis in each country, because I think we are going to have to change and strengthen each country's capacity to have in place surveillance systems with the necessary sensitivity and effectiveness to quickly identify any change in a known disease or when a new disease arises. And we need to have in place all the tools in order to respond much more quickly and effectively to the new threat. I would like to draw attention to one thing, which is that it's very important, particularly when we look at the last few decades, some of the most important public health emergencies that we had at the global level, such as SARS, MERS, the influenza pandemic in 2019, and now with COVID-19, has made it obvious that we need to change and expand surveillance. We have to find how, and this is one of the priorities we've established at PAHO, we have to determine how to have effective surveillance systems based on the concept of health, that does the surveillance, that does monitoring of diseases in animals, and giving priority to those viruses that can jump the biological barrier and end up infecting human beings, as has occurred with many coronaviruses, as can happen with the flu virus. So we need to have a better ability to detect. We can't just wait until it reaches human beings, but we should have the capacity to identify something that is happening, that's strange, is occurring in others. That's one of the examples of what we can do to change. Also, it's very important to think that in primary healthcare, we have to greatly strengthen health promotion, prevention, and surveillance. During the pandemic, we had some very significant examples of countries that provided primary health care in the communities. They worked with the communities and informed people as to how to protect themselves, how to use masks, how to wash their hands, how to avoid contact. And they monitored patients to identify who was getting more sick, and then communicate with the authorities when they did identify a case or an outbreak. All of that is going to be very important and strengthens the prevention side and helps us be better prepared to respond to an emergency. Thank you.
Thank you, Dr. Barbosa. We have a question from F News, Jorge Vasquez. The question is in English, so I'll read it in English.
The debate around the origins of COVID. How important do you think it is to know where COVID came from in order to prepare for future pandemics? Dr. Ugarte, please.
Thank you, Luciana. Well, the importance of knowing the origin of the virus is high, and that has been one of the first priorities of the World Health Organization. And also several countries have been looking at the source, the original source. Although it would be difficult to know the exact origin, maybe the previous investigations and research from other epidemics or pandemics gives us a clue that there will be several researchers and investigators to be involved. And also at the same time, we will need to look at the what is the dynamic of the initial transmission of the virus. And that will help us clearly to look at how we can do to prevent the new spread of new viruses. But the one thing is to look at the origin itself, but the other one is to look at how we can early detect new viruses. So that is the main challenge that we have, and we can only do that through a strong capacity of the countries to detect and also to inform of new outbreaks. In that regards, the implementation of the international health regulations and the sharing of information, and eventually also sharing the agent, the pathogen that is involved, is of key importance. So the window of opportunity to find the origin is not necessarily long, but at the same time to find the answer will need the involvement of many actors. And this is still a priority for WHO. Thank you.
Thank you very much, Dr. Ugarte. We now change topics a little bit. I'll take a question from Aaron Prater from Fortune magazine, but a question we also received from El Comercio in Peru and from Indagando TV, Graciela, is the question of H5N1, the threat of the avian flu. So I'll go with Aaron. Aaron asks, how big of a threat is H5N1 to the Americas? Dr. Aldigueri, please.
Yes, thank you for this question. This is really a series of events that are under our radar, and I would say microscope. The region of the Americas is clearly facing a very quickly evolving situation regarding the spread of H5N1. We have signals and reports from South, Central, and North America regarding H5N1 cases, outbreaks in animal populations. So in this context, PAO, together with other agencies, including FAO, is monitoring the situation in both sectors, human health and animal health. Regarding animal health, we have to ensure strengthened surveillance in both the production sector, including the farms, and in wildlife. I'd like to really stress the need to focus our work on the production sector, surveillance in farms, including potential cases in workers of these farms. The threat of H5N1 is not related to a single specific genotype of H5N1. The real threat is the adaptation of animal H5N1 virus to human receptors. So we are clearly in the context of One Health, as mentioned Dr. Barbosa in his previous intervention, where both Ministry of Health and Ministry of Agriculture have to work together to track the spread and detect changes in patterns of transmission, including potential cases in the human population. And it takes me to the new tools that were expanded during the response to COVID-19, new tools related to the genomic surveillance, which are key for the characterization of the virus, including early detection of mutations and reassortment of genes that can trigger the adaptation of a new genotype to the human population. I hope I have answered the concerns of the journalist. Thank you.
Thank you, Dr. Aldigueri. I will take a question now about outbreaks of chikungunya in the region. I'll go with a question from Lisa Schnurring. I hope I'm pronouncing your name correctly, from CIDRAP. Lisa asks, thank you for all the information you have been sharing about the outbreak. I am wondering if there's any difference in clinical illnesses between the Asian type and the East Central South African genotype. I'll pass the question to Dr. Espinal, who can give us maybe an update also on the situation. Dr. Espinal?
Thank you very much for the question. Lisa, I think this is a very important one. Let me just say, there are three genotypes of this virus that has been described. And all of them with a distinct genotype and antigenic character. The West African, then the East Central South African, and then the Asian genotypes. And there has been presence for some time. And in the Americas, for instance, we know that two of them are circulating. You know, there are evidence showing that in Brazil, for instance, the Asian and the East Central South African types are circulating. Nonetheless, they are different, and we need to put in context, as Dr. Aldigueri was saying before, virus, they adapt, and they can mutate, and so on. So, but so far, I mean, the clinical symptomatology of chikungunya is clear characterized by joint pains, strong pains, and high fever. And 85% of the cases in chikungunya, it's mild. It's not severe. So we haven't seen major differences between different genotypes. Now, when we talk about co-circulation of viruses, or two, for instance, there is some evidence that there might be some co-circulation of two genotypes together. And if we look at dengue fever, when different genotypes of dengue co-circulate together, there has been cases of severe disease. This hasn't been totally confirmed in chikungunya. And again, most of the cases is as a mild disease and so on. But, you know, this is what is called evolutionary science, you know, that we need to watch and we need to keep watching. But so far, chikungunya is pretty clear on joint pains, fever, arthritis, and so on, and recovery from, but there are some severe cases. I think I tried to answer the question. Thank you.
Thank you, Dr. Espinal. Unfortunately, we're coming, estamos casi al final, llegando al final de nuestra sesión. Tenemos.
We are coming to the end of our conference. We have time for one more question. I'll take a question from Daniel Gonzalez in Mexico. It's very similar to questions asked by Luhaler and others. He's asking, we want to see an end to the pandemic, but what are the current recommendations from PAHO to achieve this objective in the region? And we will end with our director. There are major expectations at play because we've left the more acute situation behind us. But as we've said today, and as we've said in the past, everything can change with a new variant. So it's very important for us to realize that the pandemic has not ended. So first, we need to maintain a level of surveillance that will let us track closely what is happening in every country. And within each country, we need to know what is happening in each province, state, or city. Because if there's any change, if there's an uptick in cases, the authorities must be ready to take steps to slow down transmission and also to pinpoint any changes in transmission that may be due to a new variant. That has to be known very quickly. And as we said, the genomic surveillance network supported by PAHO is not just for now. It's also going to be useful in the future so that we can have effective monitoring. Second, vaccination. Unfortunately, there was a lot of misinformation and rumors. That is still the case, and many individuals don't really understand the importance of getting vaccinated. Those who are vulnerable, the elderly, those who are immunocompromised or ill, need to understand how important it is for them to receive the boosters. Given current evidence, the protection offered by vaccines starts to decrease after 4 to 6 months, and that's where boosters come in. We have excellent vaccines to prevent severe cases and deaths, but vaccines cannot prevent circulation entirely. So that's why we need to continue vaccinating to save lives. We need to step up surveillance in every country to identify changes in transmission patterns, because I think that is the best way for us to maintain the downward trend in number of cases and deaths and avoid the negative impact on individuals, families, as we have seen in the last 3 years. Thank you. Thank you, Dr. Barbosa. Thank you, Director. Colleagues, we have come to the end of today's session. I see that we have many specific questions about vaccinations, specific countries. You can find more information on our website, It's www.paho.org. We are available for any follow-up questions you may have. Send an email to our media team, and we'd be happy to share more details with you. Also about our next press conference. Thank you for joining us today. Have a good day.